bacteria or virus or parasite. And when your body temperature is hot, it helps in fighting the infection. So some scientists or some researchers will say that if the child is not having discomfort or is not uncomfortable, allow the temperature to be there to help in fighting the infection. Don't be in a hurry to bring down the fever or the temperature. So when the body temperature is hot or there's high body temperature, it helps the body to recruit the soldiers of the body, the white blood cells, to come in to fight the infection. So when your body temperature is hot, it aids your body to recruit your white blood cells from your bone marrow and then from other sites in the body to come and fight the infection. Then also, when your body temperature is hot, the microorganisms are not able to multiply very well. They prefer your normal body temperature to grow and multiply. But when your body temperature is so high, it's harmful to the bacteria and then the organisms. So it impairs their multiplication. So you can see that fever is actually sometimes good for the body. However, there are harmful effects of fever. So when the body temperature is so high, sometimes 41 degrees Celsius and above, it can be dangerous to the body. The body will start to malfunction. So your heart, your brain, your lungs, your kidneys will start to malfunction. And you can have multiple organ failure from that effect. So when the body temperature is so high, it can be harmful to the body. Then also, when you have a fever, you can easily become dehydrated because when the body temperature is hot, you tend to breathe faster and more deeper. And then you tend to lose a lot of fluids from your skin from the higher body temperature. So if the child is also not drinking well or eating poorly or very weak, then you can quickly become dehydrated, and that can also be harmful for the body. And also in children, between the ages of 6 months to 5 years, when they have a fever, they can quickly develop febrile convulsion from that. Because of the immaturity of the brain, when they have a fever, the fever can simulate or stimulate a seizure or a convulsion in them. And that can also be frightening for the mothers and also for the caregivers. So these are some of the harmful effects of fever for the body. So when a child has a febrile convulsion, the child will lose consciousness. The child will be shaking the arms and legs. Sometimes they can have stiffness of the body or twitching on one side of the body. These are all manifestations of febrile convulsion and fever. It can sometimes be very frightening for the mothers and also for the other caregivers. But it's commonly seen in children who have a fever. When the fever has not been managed properly or been controlled properly, can simulate a febrile convulsion. So how do we manage fevers in children? So the key word here, I would say, is treat the underlying cause. Look for the underlying cause and treat it. Because in an attempt to bring down the fever, if you don't treat what is bringing the fever on, the fever will resurface again, sometimes even in a worse form. So when the child is brought to the clinic or the hospital, the doctor or the clinician, main aim is to look for what is causing the fever. Is it malaria? Is it a common cold? Is it bacterial meningitis? Is it sepsis? Is it an ear infection? So we do a thorough history and examination. So doctor will examine the child from head to toe, looking for any site that could be causing the fever. And then we treat the condition. Examine the ears, examine the throat, examine the chest, look for any skin manifestation of an infection, do a laboratory test. So do a blood test to look for any increased white blood cells in the blood or any malaria parasites in the blood to diagnose what is causing the fever. So that is very, very important when it comes to management of fever in children. So there are some drugs that can be used to bring down the temperature. Paracetamol, also called acetaminophen, and then ibuprofen. These are drugs that commonly we use to bring down the temperature. So what these drugs do is that they reset the thermostat back to the normal set point for the body. Then the fever will subside. But the key word here, I must say that if you don't treat the underlying cause, the fever will resurface again, and the child can be in a worse form. In addition to, the child should drink a lot of fluids. So like I mentioned, fever can lead to dehydration. So here, the child should be encouraged to drink a lot of fluids. Water, coconut water, any ORS, any juice available, the child should drink so that the child doesn't become dehydrated. The child cannot drink, then usually the child should be admitted, and then the child will be placed on intravenous fluids to prevent dehydration. So I added these don'ts to the presentation to also educate us about some misconceptions and some do's and don'ts about management of fever. So in children under 2 months of age, we don't recommend giving them paracetamol. So neonates, children below 2 months, it is not recommended. The reason being that their liver is not fully matured to handle paracetamol. So sometimes it can be dangerous or detrimental to their health if you give them paracetamol. However, if the benefits of the paracetamol treatment outweighs the risk, sometimes we will risk and give them paracetamol. But more commonly, if a newborn or a baby below 2 months has a fever, we don't give them paracetamol to control the fever. We treat the underlying cause. So if any caregiver, your mother here, has a baby and doctor is not giving paracetamol, don't be alarmed or don't be worried. It's because the baby's liver is not fully matured, and we don't want to risk the baby's health. And then later the baby will have a liver problem. So we wouldn't give paracetamol to that baby at that moment. Then also, for ibuprofen, we don't give it to babies 3 months and below, because ibuprofen has an effect also on the kidneys. So babies to their kidneys are not fully matured. So give them ibuprofen, it can have detrimental effects on their kidneys. So paracetamol and ibuprofen not recommended for younger infants. Then also for children less than 16 years, we don't give them aspirin, because when they have fever due to a viral infection and then give them aspirin, they can have a severe disease, severe liver disease called Rice syndrome, and that can even lead to death in those children. So maybe as an adult, you have aspirin in the house, maybe for a different condition, please don't give it to a child below 16 years because it can be detrimental to their health. Then also, I'm sure we've come across tepespongin, bonunsio, it's dangerous. And now we are shying away from that practice as clinicians and doctors and nurses, because it's shown to be detrimental to the health of the child if you do it. It's very uncomfortable. I remember when I was a kid, when you have a fever, sometimes it's even very cold water, because your mother or your father is in a hurry to bring down your temperature, and then you start shaking, start shivering and shaking. It's harmful to the children, very uncomfortable for them. What you do when you reduce their temperature with tepespongin, you're only reducing the peripheral temperature, but the temperature within the body will still be hot. So it's like you are deceiving yourself as the manager for the child. So it's not recommended anymore as a form of treatment for fever in children. Then also for ibuprofen, there are some don'ts. So if a child